Bismillahirrahmanirrahim. Today we will talk about how to measure the heart calcium through computed tomography or the cardiac calcium and what is Agatston score and how we will calculate. Our objectives is the introduction of the cardiac calcium and why is it important to find out or to quantify the calcium, deposited calcium in the coronary arteries, how we will measure the deposited calcium in the coronary arteries and what is Agatston score and how we will calculate the Agatston score. And in the last we will go through some quick examples. A cardiac calcium is actually the deposition of the calcium in the coronary arteries, and coronary arteries are those arteries which are supplying oxygenated blood to our heart. A cardiac calcium score is a number that tells us how much calcium is deposited or present in the coronary arteries. And to measure the coronary calcium, first we will do the heart computed tomography scan. Okay, we will do a CT scan of the heart only, and our FOU would be sufficient to cover the whole heart. And after that, but keep in your mind one thing, that we will go through without contrast scan. Okay, we will not inject contrast by finding out the cardiac calcium score. Okay, why does calcium matter if when deposited in the coronary arteries? Coronary arteries are supplying oxygenated blood to our own heart muscles. This is a normal coronary arteries. This is normal flow of the blood to the heart. And here you can see that the area become narrowed. Why it's become narrow? Because of the deposition of these plaques here, here, and here. Okay. These plaques are called atherosclerosis. Atherosclerosis means that the hardening of the arteries. This artery become hardened because of the deposited calcium here. Okay. And when the artery become harder, it's the area become narrower, and the supply of blood to the heart decrease with time. Okay, and in some time when the atherosclerosis fully block the coronary artery, and then all the supply of the blood to the heart become cut off, and this is a final cause of heart attack. Okay, how to measure the score? What Agatston score is giving us a specific value of the calcium in the heart. Okay, how we will measure? Two steps we have to keep in our mind: how much area the calcium has covered, and we will measure that area in the millimeter square, and how much is the density of that specific calcium. The density we will measure in the Hounsfield unit or the Hounsfield value. Okay, keep these two things in your mind. Okay, simple steps to calculate the Agatston score. First, we will do a non-contrast computed tomography scan of the heart. Non-contrast means that we will not inject the contrast. If we do a non-contrast CT, you look here. Here is some hyper-dense or bright areas. These are basically the calcium in the coronary arteries. Okay, if we put after scan, if we put ROI here, it will give us a specific Hounsfield value or Hounsfield unit. If we put here, it will also give us some value here and here. Okay, this is non-contrast scan. If we do a contrast scan, and the contrast scan will more quantify the or will give more Hounsfield value to these all area. Now, non-contrast CT scan, if we put ROI here in this coronary artery, it will give us a lower or a less value of the Hounsfield unit. But if we inject contrast and after that we put ROI here, it will give us a higher value. That's why we are going through a non-contrast scan to accurately find out the Hounsfield value of the calcium. Okay, in the second step, we will find the calcium in whole of the coronary artery. This is a single slice. In the single slice, here is the deposited calcium. But if we scroll the whole scan from top to bottom, it will give us more spots if there is a calcium. Okay, More spots mean many different areas of the coronary arteries where there is calcium. Okay, after finding out the spots, we will then go to the Hansfield unit. Hansfield, to find Hansfield, it's very easy. It is giving, the software is giving us the Hansfield value. Just putting the ROI on that bright spot, it will give us the Hansfield value. But which Hansfield value is important for us in the coronary, in the case of the coronary arteries calcium? The If the Hansfield value or Hansfield unit is greater than 130 or 130, we will count it. If it's down then or lower than 130, we will not count those value. Okay, here we will measure the spots where there is the calcium. We will find out the area. Look over here. This is a one area where there is calcium, and this is another area. This is another area. We will find out the area. The area we are measuring in the mm square. Okay, suppose this is 5 mm square or 10 mm square, and this is suppose 20 mm square or 15 mm square, and this is 3 to 4 mm square. We will find out all the areas. This is in one slice. We will scroll down all the, this is suppose from this area. We will find out the areas here, here, here in all the slices which covered the heart. Okay, after that we will find out the Hansfield units or Hansfield value of each of that area. We will find out the Hansfield value for this one, for this one, for this one, in all the heart, okay, in the coronary arteries. What we are gonna do after that, okay, now we already find out the areas in mm square, and we will write down on a paper or somewhere to record, and then we find out also the Hansfield values. To the Hansfield values, we will give a specific number. If the Hansfield, look over here, if the Hansfield value is lower than 130, we will not count. If the Hansfield value for the some areas is 130 to 199, we will give the number first, from 200 to 299, second from 300 to 399 Hansfield unit, third, and if 400 or more than 400, we will give the value 4. Okay, what we will do next? Now already the area, we found out the area, and we given specific number to the Hansfield value. Okay, we will multiply the area by that score. Suppose the area is 10 and the weight and the score come in a 2. Number 2 means the Hansfield value is from 200 to 299. After multiplication, it will give us a score of only that specific spot. Suppose we find out the score for this spot only. Okay, after that we will find the score for this one, and in the last we will add all the scores, and the addition will give us the final coronary calcium score of that patient's coronary arteries. Okay, this was a sample thing. Okay, after the last answer, suppose we add all the scores, and here we got an answer. The answer we will categorize. If the answer was 0, means that no calcium. If the answer came from 1 to 10, like 5, 6 or 7, then this is a minimal. From 11 to 100, it's mild. From 100 to 400, it's moderate. And if 400 or more than 400, then it is high. Okay. Now come over here. If it's 0 means very low risk of heart attack. If 1 to 10, low risk of heart attack. From 11 to 100, moderate risk of heart attack, and 101 to 400, higher risk of heart attack. And if more than 400 or 400, then highest risk of heart attack. And this is the formula through which we can find out the chances of heart attack to each of the patients. Okay, like how prone the patient is to heart attack by using the simple formula. Okay, here is a quick example. This is one patient having, when we did the scan of his heart, there are 4 areas in the coronary arteries where there is a plaques. Okay, first spot, second spot, third spot, and fourth spot. Spots mean the area, specific areas in the coronary, different coronary artery where there are calcium. In the first plaque, the area of the plaque is 15, for the second 25, for the third 8, and for the fourth 12. For the first, the density is 220, for the second 180, for the third 350, and for the fourth 400. Okay, after that, to these all Hansfield unit, we give the values. How we are giving the values? According to this formula. Okay, now look over here. This is coming 200 we gave the value to. How we give the value to? Look here, from 200 to 299 we are giving the value 2. Okay, after that, here for the second plaque, the area is 25 and the density is 180. For the 180 we give the value 1. For the third one, the area is 8 and the density is 350. For the 350 we give the value 3. How we give the value 3 for 300? Because of this one, 300 to 399, the third, and the last one was 400. So for the 400 we give the value of 4. Okay, after that, another formula which we were using, it was multiply the density. Okay, the density, multiply the area by this number, by the density number. Okay, 15 multiplied by 2, 30, 25 multiplied by 1, 25, 8 multiplied by 3, 24, 12 multiplied by 4, 48. So for the first plaque, this calcium score is 30. For the second plaque, the calcium score is 25. For the third, it's 24, and for the fourth, it's 48. Now to find out the whole calcium score for the whole coronary arteries, for all the spots, for all the heart, we will add all these scores. So 30 plus 25 plus 24 plus 48, it's 127. Now come to the formula. 127 is coming in this category from 101 to 400. 101 is coming here. That means that there's moderate calcium deposition and the patient is higher risk of heart attack. So the patient must go through quick treatments, okay, to exhibit this heart attack. Okay, this patient is a higher risk of heart attack. This is a simple formula and it's a very important formula to find out the risks of heart attack. It is very important for the radiologist, for the cardiologist, and for the competent radiology technologists and radiology technicians. I hope so you understood well this topic, and thank you so much.